And hello, hi, this is Kathy Frey from IMCO, from the International Integrated Maternity Healthcare Organisation, and welcome to this week's Maternity Natural Health webinar. And I'm very pleased to be introducing you once again to Renee Adair. So Renee, say a big hello.
Hi, good morning and good evening, wherever you're watching.
Yeah, and it's really great to have Renee back here again, because there's some parts of these topics that we have talked about before, but we wanted to go into a little bit more detail today, and it really is around that topic of, well, what the heck is a doula and why does some woman need one? Because there really is quite a misunderstanding in the generally around the difference of the roles and the purposes of, let's say, the obstetrician and the midwife and the doula. So how do they all fit in, and who does what, sort of thing? But just as a little overview about Renee. So Renee Adair is the founder and director of the Australian Doula College and the Groundwork Program, and the Australian Doula College's charity arm, which is the Doula Heart Network. And I want her to tell you guys a little bit more about that as well, which is pretty amazing.
Thank you.
Renee is a qualified birth and parenting educator. Obviously, she's a doula, and also happens to be an aromatherapist and a Reiki practitioner and a grief educator. And for over 2 decades, she's been working in a variety of spaces across that landscape of life, blending her skill set, knowledge, and passion for human rights. And Renee has trained and mentored thousands of doulas and supported hundreds of women, their partners and their families through pregnancy and birth and early parenting, and also end of life, which is the other sort of other piece to the pie that she's involved with, is the beginning of life and the end of life. So I know that she'll explain a little bit more about that. So again, we're going to talk today about that, role of the doula and how that all fits in. And so the format today is that shortly Renee has got a PowerPoint presentation that she's going to bring up, and feel free to put any questions into the Q&A part of this format. There should be a button at the bottom of everyone's screen that says Q&A. Also, we welcome you to put your details into the chat area of who you are, your role, where you are in the world. That's always great for us to know about the audience. And then any questions that you have, we'll absolutely make sure are covered off before the end of today. So thank you so very much. And here we go. I'll hand over to you now, Renee.
Thanks, Kathy. Thank you so much. I will just get my PowerPoint presentation up for you all. There we go. Magic.
Perfect. That's
It's magic. You can see that okay, Kathy?
Yes, perfect.
Thank you, thank you, thank you, thank you. And thank you for the intro, Kath. First up, I would like to make an acknowledgement of country. This is something that we do for our First Nations people here in Australia. It's very important to my organisation. We work in remote Aboriginal community training doulas. And so this morning, which is my time, this morning, it could be, I don't know where, for some of you, I would like to acknowledge and pay my respects to the Dark and Jung people, which are the traditional owners of the land on which I am on today. And I would like to pay my respects to their elders past, present and emerging. And I acknowledge all Aboriginal and Torres Strait Islander people. And I pay my deepest respects to their elders past, present and emerging. So just a quick little smattering of me. That's me as a little kindergarten girl with certainly not the vision that I have now, working with women and babies. And just on the word woman, I would also like to include birthing people, of course. I'm currently working with a trans man who is having a baby, and it's an absolutely remarkable and wonderful experience. And I think it's important to just put it out there that I think when we're working in these spaces now, that it's really important to acknowledge the title and the pronouns that people will choose to be and preferred to be called. So some of my slides will say birthing people and some will say women, but it's all about the broader context of supporting people who are having babies. I had my own babies in 95 and 97. I had two remarkable home births. I was already working as an aromatherapist and Reiki practitioner, but that was the turning point for me, was really having those exquisite, remarkable experiences of natural childbirth, which really helped me understand that really there was not a great deal of good, solid information about what was possible in birth, particularly here in Australia, but then obviously over the years it's been in the greater context of the way that we treat women and birthing people around the world while they're having babies. I then worked in child protection for some years, and after that started the Groundwork program, and then rebranded in 2007 to become the Australian Doula College. And in 2009, launched the Cert 4 in Doula Support Services, which is still today the first and only birth and postpartum doula training that is government accredited, that we're aware of. If anybody else knows otherwise, please sing out. I've launched and published some pieces and research on doulas. I've sat on the Consumer Advisory Board for the Australian College of Midwives. We now have rebranded everything to incorporate End of Life Doula work, which is really incredible. I feel very honoured to walk beside people with the first and the last breath, which for me is actually no different in how we support. We have run an abortion doula pilot last year, which was remarkable as well. And now we have abortion doulas coming up into the fore, which is incredible. And I am on a steering committee to restore birthing on country for our First Nations women. All of which keeps me incredibly busy, but also really joyful in this space. Today, my biggest conversation with you is around pregnancy and birth. And really what I wanted to express is my general philosophy and how the college views that. And I think it's important to understand that for us, for me, birth and pregnancy is a normal physiological event in a woman's life. And I think we have overcomplicated it. I think that we have over-medicalized it. And I think we need to take a step back and remember that it is, in fact, a rite of passage. And in many cultures around the world, that's how birth is viewed. I feel like it has the ability to transform, a woman and her partner into the parents that they need to be. I think we've messed up that entirely, and we'll talk a little bit about that today. I'm sorry if you can hear my crazy cat in the background making some weird ass noises. So what the heck is a doula? So essentially, if we broke it down, this is what it would look like in simple terms. A doula or birth attendant is usually a woman, and we offer non-medical support and information to parents in pregnancy, childbirth, and the immediate postpartum period. The word doula came from a Greek word, which actually, in its correct translation, means slave. It then came to mean to be a woman's servant, and then mothering the mother and nurturing the family. And we at the college have really moved it forward again to be that it means for us to be of service in any space that we are required, and that a doula can help support someone emotionally through a major life transition. So throughout my discussions this morning, my PowerPoint presentation, I've thrown in some photographs for you to have a look and see exactly what it is that we do in this crazy space, so that you can have an idea about that and how we do differ from the other health professionals that we work alongside. And it is important to say here at this point that we do work alongside doctors and midwives and obstetricians, and we do fill a really enormous gap in most maternity healthcare systems around the world today. Women or birthing people are not having their emotional needs met. For the most part, a lot of doctors and midwives have really tight schedules. They see large numbers of people, and it's difficult to be seen as an individual. So by having a doula walking beside you, you are definitely getting good continuity of care and someone who is addressing your emotional needs during this massive transformation of becoming a parent. You can see there a woman in labor, and my dear friend Tammy, who is an amazing doula, standing beside her there whilst she is having a contraction, supporting her from a distance in that instance. And I'll talk more about how we go on and support. Obviously, I have permission to use all of these photos. It's probably fair to say that as well. So the role of the doula, it's actually really vast for me, and I feel like we come in as a blank canvas for families and absorb what it is that they are wanting, ask a lot of information about what it is they're wanting from the experience, and then really helping them get that, whatever that is, by working to a birth plan or wish list or birth preferences. So as I mentioned before, we offer continuity of care. And again, for many, many, many people throughout the world today, continuity of care is absolutely lacking when they are having a baby, and also at end of life. It's quite ridiculous to me that we don't offer better services for women and birthing people across the globe. We do work alongside midwives and obstetricians, as I said, and we work with the pregnant woman or person and their family or partner. We can also work with siblings, which is very beautiful. I love that work. It's divine. And we offer unbiased information. And I think that's actually quite critical. A lot of people will undertake hospital classes, and sadly, those classes, for the most part, and of course I'm generalizing, but for the most part, are crowded and the information is biased. People are not given all of their options and choices in that first instance, which is really critical so that you can make informed decisions. And that is a big driver for me, is all about people making true informed decisions for themselves. We can help parents navigate the system that they find themselves in, which again is critical. A lot of people will say to me, I felt like I was being driven along, I was in a revolving door. I didn't see the same person twice. I got different information every time I went into the hospital for a checkup. So there's a lot to navigate in all of that, particularly if it's baby number one. It can be very, very overwhelming stepping into that system. Sure, obviously different if you're having a home birth and you have good continuity of care with a midwife, and we do obviously support women in home birth. But it is important that we see that our main objective is to really see families move into parenting really positively and confidently, but really emotionally intact. And that is what is not happening today. We here in Australia have a ridiculously high postnatal depression rate, and research has shown us that is directly linked to the woman or person's birthing experience. We're letting women down on the day that they're having their baby, which is such a profound day for us, right? It is a day that you never, ever, ever forget. We carry that birth story with us. It is branded on you. And to send someone home to care for a baby that is diagnosed with PTSD, which was a diagnosis that we keep for people who are in war, they've experienced war-torn violence, is atrocious. And we should be ashamed of ourselves, really, on a global scale, that this is happening to women when it should be the most beautiful and joyous time of our lives. This is an early picture of me there. I'm on the right screen, looking somewhat younger than I am today. This was a beautiful water birth. This woman was not far off having her baby. And the woman to her left is her sister. And the woman having her baby did a remarkable job. It was her firstborn, actually. And she had a really remarkable, I think it was about a 5 or 6 hour labour, which is pretty great for a first-time mum. And that's in a Sydney birth centre. So how do we actually then differ from midwives and doctors? So essentially the big one is that we don't perform any medical tasks. We do not offer any medical diagnoses, and we do not administer drugs. Here in Australia, we're not employed by the hospital system, and I do know that there are some countries around the world now that are taking on board doulas and are employing them within the context of the hospital system. I'm going to say this out loud. I'm not sure I think that's a great idea, because as a doula, I know I can't serve two masters. So I would feel uncomfortable, I think, grabbing a paycheck from my employer whilst I was giving information to women and their partners in labour that might be counter to a hospital policy. I don't have any restrictions on my working hours or shifts, so I don't do shift work. So if, for example, a birth, you know, I'm with a birthing person, I don't clock off 12 hours into my working shift, into the labour. I think the longest attendance of a birth that I've ever done, like full on, was about 36 hours. And that's the continuity of care that we have available to us. I've been on a couple of births where, you know, the shifts have come around and I'm seeing the same faces that have already gone home, had a sleep and come back to work the next day. That's quite a significant difference. And we can move from home to hospital with our clients. So midwives and obstetricians and doctors don't have that ability. So doulas can do some really great work in the home prior to getting someone into the hospital when they're ready to birth their baby. This is me again supporting at a home birth. And you can see an elder sibling on my lap, and that's mum having a very large contraction by the pool that we had set up for her to birth in. And Kelly there was one of our doulas, and she has now gone on to study and become a midwife herself. The mother of 6 children. I don't know how she did university, but she did it. Amazing. So how does support then look like? What are we actually offering? So we can assist women and birthing people and couples to prepare for the birth and the immediate postnatal period. I think it's very important that I also state here that we're non-judgmental, particularly myself. I will support all birth choices, from home to hospital, birthing units, delivery suites, and also cesarean sections. I think that there may be some doulas who may see that differently, but I feel like it's about the emotional support. What is it that I can do to help you to make your experience, whatever that experience might be, better, and remind you that it is an important day and that you do, no matter where you are, have options and choices. A doula listens intently to a person's needs, wants, desires, fears, feelings, and acts as a sounding board. I think that it's important that we validate those fears and feelings, that we offer resources, refer on if we need to. We're offering tons and tons of verbal encouragement and lots of love and nurturing. We allow freedom of expression and movement during labour and birth, and we really have a hands-on approach in there, if that's what the person wants. Some women have hired me over the years to just be in the room, in the space, wherever that is, just as, I guess, a backup, really. That has been enough to give them whatever it is that they've needed to feel safe, to go into the places that you need to during labour, to feel vulnerable, which is very cool. And some women or people are very, very hands-on. It's very hands-on, and I'm really busy, and it's very physical support. Doulas have a great team approach. So we are there to work alongside partners who I consider primary support people, obviously midwives, obstetricians, doctors, etc. Maybe mums, mum-in-laws, sisters, whoever else is at the birth. We can offer alternatives, and a lot of them often, to the medical models of pain relief, and that is obviously awesome for women who are wanting a natural, normal birth experience. And my job, I think, is really to exhaust all of those options first. So I will throw all that I have in my doula kit and up here and in here to make sure that, you know, a woman or birthing person gets what it is their vision for their own birth, whatever is on their preference list. And I will exhaust all of those options before, you know, if she starts to struggle, before any models of medical models of pain relief. We can work with partners, which is this is critical, to give them guilt-free breaks. And, you know, I'll say this much, the poor old fellas that are at birth today have really, I think they struggle. A lot of men struggle. It's really only this generation of guys, and I'm talking about men now, obviously not same-sex couples, it's a little different, who don't often have their fathers to go to and say, what was it like for you, Dad, at the birth? What was it like? Did you see me born? Were you involved? All of those conversations that we may naturally have with our own mothers. And I feel like there's a lot of pressure on them to know everything and be that person and the one that, you know, their wife or partner is going to lean on quite significantly during the experience, when actually they're having their own experience as well. And they're emotionally plugged in. It's very difficult to be that person and not have support yourself. So doulas can really, really help partners before, during, and after the birth of their baby, because it is just as transforming for them as it is for the woman herself. Domestic duties and post-birth care is awesome fun. Love, love, love. Offering education and support, breastfeeding and feeding tips and tricks, sleep and settling, cups of tea, all of that stuff. We've even got, you know, we have doulas here who are happy to cook meals, prepare meals, and really, really make that first few weeks at home much more, I suppose, easy, and helping parents connect with their baby and each other in a really profound way. Here's myself again supporting Kelly at this was her last baby number 6, Archie. Just sitting in that space, I think, is a very beautiful part of our job. I have no expectation about the outcome. I'm not emotionally charged or plugged in. I'm just there to experience and assist her and her partner and family. In this case, it was a lot of kids, 5 children, really just to be in that space, one surge at a time, one wave at a time, and offer support and suggestions, whatever it is that they need. I want to talk briefly about doula training because it's huge and very, I think, contentious actually all across the globe. Here in Australia, it varies from state to state and territory, and courses range from entirely being online with no contact at all to sort of some weekend workshops. As I said, we have the only government accredited birth and postnatal doula training in the world. It's a Cert 4 in doula support services. It's extremely comprehensive, and it can be completed either face-to-face or via correspondence. It can take up to a year to complete our training, and all of our students have to complete 3 experiences and complete an open book exam. And we get our members and our students to work under a code of conduct and ethics. And I think that's very important too, that people know that their doula has been trained and that they are following some guidelines about their practice. And that also, I think that they have some ongoing supervision. This is one of my favorite photographs of me at work. And I don't have many, actually, even though I've been to hundreds of births in my career. I'm often the one either behind the camera or obviously I'm working. So this is very precious to me because Kelly is a very dear friend. And that is the birth of Archie after not very many hours of labour once he finally was ready to arrive. Kelly had had a really long pre-labour that had stopped and started over a couple of weeks, actually. So it was becoming quite stressful. She was getting quite tired and quite frustrated. And at the time, I was living about an hour and 20 away from her, an hour and a half away from her. And I just ran in the door pretty much, and she was ready to have her baby. She had a lovely home birth midwife. So talk a little bit about the benefits that we know about having a trained doula, which came out of research in the US. Some of you may know about Klaus, Kennel and Klaus. The story is remarkable. We know that there is a reduction in cesarean rates when you have a doula, that it is possible that you're having a shorter labour. There's a huge reduction in the request for analgesia, epidurals, etc., which then reduces the risk of having a forceps or a ventouse birth, delivery. We know that we can help improve breastfeeding outcomes. There's a decreased incidence of postpartum depression. And I think that's probably also related to how the birth experience has been and how someone has been treated during that experience. You know, just by having somebody in that space really be able to buy time for you is critical. If things start to deviate outside of your birth plan or wish list, that someone comes back to that and says, hang on a second, that's not on Mary's birth plan. Can we just have a minute to think about that? And I just want to touch on the fact that I've only ever seen 4 real emergencies in my entire career. Every other birth experience, there's been time to just wait for a moment and explain to mum what's happening before she's wheeled off for a cesarean, so that she understands, and that's just one example, she understands what is happening to her. Because we know when any situation where we feel out of control, that really does bring a great deal of fear and also questioning on the other side. Doulas can also bring greater maternal satisfaction, which I just mentioned there, but also better mother-infant interaction. And I would also add there that I feel like we also can help really partners come together and better understand how they can support their partner in that immediate postpartum period. This is a beautiful couple that I worked with quite a few years ago now. And those smiles are a successful VBAC. That's a vaginal birth after a cesarean section. Their first baby was born via a C-section, and they hired me because they wanted to achieve a vaginal birth. And they did. Have a look at that big bubba. So beautiful. The smiles just speak volumes to me. All right, so how do people work with us? So at the college, we have a base package, and this can be built on either for pregnancy or postpartum. Essentially, we offer an obligation-free interview, 3 visits prior to the birth, and they are in the last trimester, in the lead up to someone's estimated due date. We attend the labour and birth. Doesn't matter how long that is. We don't do a shift change. And we offer 2 postnatal visits in the home. And that's our essential package. Many other doulas offer add-on services such as belly casting, pregnancy massage, or placental encapsulation. And some doulas only offer postnatal packages. So, for example, over the years, we've had couples who may have had, pregnancy loss or lost a previous baby, maybe had a baby that was born still, or had multiple miscarriages. They particularly may require a lot more support in early pregnancy or in the second trimester. So we work with individuals to create a package for that. In the same space, we can do the same in the postnatal area. Some people might not want us for the birth at all, or they might want birth prep, then we're not at the birth, and we might see them later postnatally. And some people might only want someone postnatally. And some of our doulas work up to about when the baby is like 5-6 months of age in the family home on a regular basis, supporting them in that transition to parenting. Particularly helpful, obviously, if there are other siblings around. I think this daddy's face says it all. Another beautiful water birth. These clients go back a long time in my career, but this is still one of my very favorite photographs. And I think his face absolutely says it all. Absolutely beautiful. That moment when parents meet their baby for the first time is sacred business. And I feel like when we interrupt that and we medicalize that and we take away that opportunity that you can see there, we really, really are fucking it up. There's no other way to say it. And who knows really what we're doing to humanity on a global scale by over-medicalizing what really is and does usually go right when we leave it alone. So who might hire a doula? First-timers, a lot of first-timers are now hiring doulas, which of course is music to my ears. Someone who has had a doula previously for birth or previous births, someone who is wanting to achieve a vaginal birth after a cesarean section, someone who may have experienced birth trauma. And unfortunately, we know that is a reality, and it is one that is on the rise across the globe. We've just had our, we have a mothers and babies report that comes out here in Australia every couple of years, and it's just, we've just have a new print that's come out, and seriously, the numbers are embarrassing. A 38% cesarean rate across the country, And we're sitting at around a 45% induction rate. And we all know there's no surprise that induction leads to a lot of intervention. That they're pretty disgusting numbers. And I was quite shocked, actually, because when I started, very few people were being induced and there were way less cesareans. So I feel like we're going backwards. I don't feel like we're progressing. And when you look at the results and the outcomes, you know, our stillbirth rates are not any better than they were 20 years ago. So all of this intervention is actually it's not helping. And the increase of our postpartum depression rate is obviously a reflection that we're not getting it right. So we need to do something. Something needs to shift. So some people will hire us because they have no partner or other support in place. Some would hire us for sibling support, which is a delicious job. Love it. Emotional support, cultural birthing practices. Some people will hire our doulas for that alone. People wanting continuity of care, which is everyone needs and deserves continuity of care. We know that, and research has proven that continuity of care makes a massive difference to any experience that we have in our lives. And also support in the LGBTQI community, gay, lesbian, trans people, non-binary people having babies today is massive. And look, I have to say, the discrimination that comes with some people working within this hospital systems, and I can only speak here in Australia, but I follow a lot of information in the LGBTQI space. It's very near and dear to my heart in the US, and it's happening everywhere. And I feel that when we have judgment in that space, in any space, when we judge anyone for their choices and options around birth or end of life or whatever it might be, that we're taking away and robbing them from their own experience and saying that what they're doing is not right. And as a huge advocate for human rights, I just don't think that as other people in the world, we have the right to do that. I really feel like everyone deserves the right to love and nurturing and kindness when they're having a baby. It's pretty simple. Obviously, another mama that I've worked with, holding her baby, tucked up in bed for the very first time, and I think her smile says it all. Some client comments there to wind up. So I consider myself blessed to have had such an amazing person in my life, sharing my precious birth experience and believing in me. So doulas really do believe in our clients. It was wonderful to have such a calm and reassuring person present, and choosing to have a doula helped both my husband and I to relax, feel supported emotionally and physically in the weeks prior to and during the birth. Another photo there of clients. That was Tammy's clients that you saw earlier. And I love this final quote, which is from a really old Suzanne Arms video, which was one of the first that I ever saw when I was training to be an educator, childbirth and parenting educator and doula. Challenges and Choices, it was called. If you haven't seen it, try and hunt it down. If a doula were a drug, it would be unethical not to use it. Thanks, Kathy. Over to you. Do I need to stop my share?
Yeah, that would probably be good. Yeah, well done.
Hi.
So interesting, isn't it? And thank you for that refreshing overview. You know, it is always so interesting, and it comes down to understanding those different roles, isn't it? You know, in general terms, I always sort of explain to people that the difference between a midwife and an obstetrician is that a midwife is the expert in normal which means we are the expert in picking out when things are not normal as well, because you can't be an expert at normal without being able to see what's not normal, right? So that's the left and the right side.
I think there's a philosophy there too. I think, you know, midwives have a philosophy. They view birth as a normal, natural, physiological event in a person's life, in the same way that we would do that. Whereas an obstetrician, their philosophy is that the pregnancy and birth is an accident waiting to happen, for lack of a better way of putting it.
Yeah, and the obstetrician's specialization is abnormal. That's exactly where they step in. So when things have changed through the pregnancy or through the labor or through the birth or in the postpartum, then, and when things are no longer normal, then that's when our obstetric colleagues, that's their specialty, and that's when we should be discussing the situation with them, and ideally as a three-way conversation between the mother herself and her partner, family, and the midwife, who is her caregiver of normal, and that specialist who is the expert in how to deal with things that are not normal. However, we all know that especially in private care obstetrics, that's just not how things are done. So a lot of the time, not all obstetricians, but certainly a lot. So when it's in a private care situation, often the woman is seeing the obstetrician when things are completely normal. And unfortunately, what we know is, and really robust research backs this, is that when we get the medicalization involved with a normal situation, that we are turning it into abnormal.
That's right.
Which gets known as
I think
it's that cascade of intervention. Oh, let's fiddle with that leads to that, that leads to that, to leads to that. So
insurance is the big one there.
Absolutely.
People believe that they've got their private health insurance, so they'll go with an obstetrician. They think that they will be seen by that obstetrician as an individual. They think that they will get better care. They are wanting that the post in the immediate postpartum period, wanting that individual room. Those things seem important, and I think that's one of the drivers for our cesarean and intervention rates that's gone up, is because women who present as normal, they're having babies at a normal age, non-geriatric. You know, there's no other markers to be seeing an obstetrician, but they step forward into that relationship, and I think some women, you know, get a bit railroaded into.
It does, and it doesn't help that from a private obstetrician perspective, who's being paid their services by insurance. At the end of the day, unfortunately, it is what it is, but they make more money with C-sections. So why would there's just a huge disincentive to keep things normal, because for that obstetrician, and sorry to those obstetricians who are very holistically and naturopathic.
And there's plenty. I know plenty.
Fantastic ones, true. So we know that, and we love them. But unfortunately, there is that situation of, why would somebody want to be up all night awaiting for the natural arrival of a baby that could occur at any particular time and nobody really knows, versus booking a woman, their client, in for a C-section during normal business hours and earning more. Right? So they'll earn more to be able to do that, and they're not up all night. So it's very easy to present to a woman a fear that your baby's, it's a good size. Now, we're not talking about a macrostomach, large for dates, the baby. You just hear those little words, it's a good size. You're not a big lady, and that's it. Suddenly it's all this fear. sorry, I digress.
That's
But
true.
but I guess the thing, in an absolutely optimum situation, when we follow the World Health Organization, recommendations for best practice,
Yeah.
every single woman would be seeing, with continuity of care, a
Correct.
midwife who they see through the pregnancy. She attends the labour and birth, and then she comes and does some home visits afterwards and keeps that continuity of care.
Mhm.
But what we realise is that that's not what most women get. So most women will attend antenatal clinics and see various different people along the way, and they lose that continuity of care because that's how their health system is based in
Yes.
their location.
Yeah.
And that's where that doula can often be that one person who gives that consistent continuity. And it, because you do have things explained, often when a woman will say that they feel so confused that things are explained so many different ways and they're receiving all this different information. And as a midwife, I can hear, say 4 different midwives explain the same piece of information in 4 different ways. And I know they're actually all saying the same thing pretty much, but those subtleties and how things are said, so for the woman receiving it, it feels like 4 completely different versions of something.
Right. It can be very deep, confusing, and then that adds to the fear. And someone can also feel quite, I'm going to say dumb, like going, hang on a minute, disempowered and not, and then really not being able to go somewhere or have that sounding board to ask questions. And I feel that's a big doula role, is really helping someone understand the language.
Yes.
When you get into the system,
that interpreter
language, and you need an interpreter almost. It's crazy. And to feel frightened and to add to the fear that most people have today having a baby, which is that's a subject we could talk a whole hour and a half or 2 hours on our, that's a whole subject. The fear that the people have today is off the charts. Like
I agree. I mean, women have never
having my babies with my clients 20 years ago. I didn't have the same fear. It has absolutely trebled. Like, is that a word? It's like,
I mean, women have never been so fearful when birth has never been so safe.
Right. Or allegedly safe.
Well, no, but I mean, it's even with our horrific C-section rates, we're still not dealing with women of a century ago, when women would routinely die of things that we don't routinely die of anymore, in birth and postpartum. So it is crazy that we have got these insane levels of fear. So that continuity through the pregnancy, and that one person that will, because when women are in labour and they, arrive at birthing suite, unless they are in a country that provides that midwifery continuity of care, which is rare, I believe that it's really only New Zealand and the Netherlands that does, then that doula is that one person that they recognise. They're not arriving in and having to instantly build some rapport with a midwife they've never met before, and she's only going to be there for a few hours because her shift will change anyway. So that continuity is there, but also in the postpartum. So I always sort of say to a woman, what you need in the postpartum is somebody that's in that role, like a cross between a big sister and your best friend, and this person who has successfully breastfed themselves, preferably 2 or 3 babies. And yet that person who's there, who really knows their stuff. And again, if you because even with continuity of care systems, where midwives do home visits, it's still not that volume of time. They may visit, 2 or 3 times in that first week for an hour or so. You
Mm.
need more than that.
Yeah.
So
and it might be that you're seeing someone else that's different to the person that was at the birth. So again, that's not continuity of care. It's someone different again in your home. And, you know, I think there's a lot to be said for, you know, we've sort of, I guess, focused on the birth and the lack of support that women and families get there. But wow, in the postnatal period, it's so lacking.
That first 2 or 3 weeks particularly. Yeah. So I would say my advice to women would be that, you know, if you have a big sister who can basically come and sleep at your place for the next 2 or 3 weeks, or you have a mother who you get on with really well, and she's well experienced with breastfeeding, because yes, we know it might have been a while ago, but that stuff doesn't change. That knowledge is, you know, we have that, as long as you've got that person. But if you have not got that person, book yourself a doula.
Book yourself a doula. Yeah.
Yeah.
Nice
You want to have that
exactly,
person, because it's going to make such a difference. And yes, you've got your partner there, but has your partner ever successfully established breastfeeding a baby themselves? Probably not.
Probably not.
So that's what you want.
Yeah, it's true. It's really true. And thank you for being such a great advocate for doulas, Kathy. I think what we need to remember is that we all need to work together for the greater outcomes for people having babies. Babies grow up to be they're going to grow up to be adults. They're going to be our future. And how we're treated at birth and how we treat people at birth and in the postnatal period is, I believe, critical to how we are as humans for the rest of our lives.
Oh God, yeah. And you know, you're so right when you make that comment, you know, that you know, I always sort of use that saying, women as midwives, our clients' births blur, you know, and they should blur. You know, I don't want to be walking down the street and bump into you at the supermarket and I remember every single detail about your birth. No, not at all. Like, I intentionally let it blur away. And, you know, and yes, if I pick up notes and I read through those notes, then I can recall those details. But, you know, and there will always be certain births that we never forget as midwives.
Yeah, sure.
But, in general terms, it all blurs together, and it should blur, and that's a healthy. But for the woman, you know, as midwives, we can lose track of clients in our memory banks. But as women, you never forget your midwife, or your doula, or your obstetrician, or basically all three. You never forget those people. You never forget the impact that they had on your life for the rest of your life.
Whether that was positive or negative, right?
Yes.
So that's the thing to remember, is that, you know, and I use the word branded. I say we're branded with our birth stories, our children's birth story.
We are branded.
And when I think you hear the word branded, you think, whoa, that's, and it is, it's that deep, deep, deep story that sticks with us. And for me, my heart breaks when that branding is so horrible that someone doesn't even want to go on and have a second baby.
Yeah.
That the trauma is that
the trauma
and the story is so awful that they feel they'll never ever recover. I mean, how as a society do we think that's okay and acceptable? If that was happening in any other field of medicine, there would be outrage.
There would be. You know, one of the crazy,
absolute outrage. Yet here we are giving birth to another human being, a soul, right? Spirit coming in. I don't care what you believe, but this is it's God coming in, right? And I'm not a religious person, but I feel the depth of that for that woman and her partner is sacred. And we're robbing people of the sacredness of the experience. It is a rite of passage, and we are taking that away. And why? How? is that acceptable? Because it should not be. And if it was happening elsewhere, somewhere else, it would be there would be outrage. And I feel like we need to get outraged now and say enough is enough.
Oh, we do.
Not okay,
It is just ridiculous. I mean, there is absolutely no other situation, because, I often compare the fact that the calorie output in a labor is similar thereabouts to doing a marathon. And in what situation, apart from women giving birth, in what situation is it common practice that somebody would do a marathon and then immediately after the marathon have major abdominal surgery, which is what a C-section always is? It may be common, but it is still major abdominal surgery.
Correct.
And then immediately after that, get given this tiny little pipsqueak and told, hey, feed and look after this little being, 24 hours. And by the way, you need to feed it every 2 hours. In what situation does any person have major abdominal surgery after a marathon and then get told you can't sleep properly for the next indeterminate period of time because you need to feed this baby? I mean, it's just, we are setting women up for postnatal depression. We are lining all those ducks up in the row so that it's almost impossible for her not to have an experience of depression afterwards.
I agree.
Right? In fact, we have to go, those women who go through that process, which often starts with an induction, because that immediately takes the labor from normal to high risk.
Right.
Any woman that goes through an induction, failed long twos, failed forceps, have an emergency C-section, throwing the baby straight away, and she does not get postnatal depression, I think she's just she's a goddess if she can go through that and not experience postnatal depression. It's become so normalized, it's absolutely insane. But when those women make that investment in a doula, what they're doing is they're investing in their baby having a normal birth.
Yeah, and even if it does end up in a cesarean, I'd say, even if it does end up in a cesarean, they're going to have someone who has exhausted all the options, someone who's bought some time to ask questions, someone who's looking in their eyes saying, this is not what you wanted today, but your baby has other ideas.
That woman can put her hand on her heart and just say, I know I did everything in my power. I fully invested in this, and it went a bit pear-shaped. But the thing that is so haunting for women is when they don't really engage completely as much as they kind of know that they should have in that first pregnancy, particularly, because they were busy at work and they worked till 36 weeks or 37 weeks, and they never got round to reading that Suzanne Arms book, and they thought, oh no, I don't really have the money to spend on a doula because I'm buying the new cot and the new pram and the new this and the new this and the new that, and instead of buying those secondhand and investing in education and doula and support, it's but when those women do it, when they invest, they're setting themselves up for that cascade of normalcy. And that's why those cesarean rates are down by 50%, because they're already in that headspace of, I'm doing everything I can to line my dominoes up in a row to give this baby the best birth experience it can have. And as an aside, of course, when a baby has the best birth experience it can have, well, so does the mother. Exactly. I know we're preaching to the converted, but it's just and I love your comment about the fact that you're saying that you can count on one hand the amount of times that you've seen during a labor where there is a genuine bells and whistles, code red type emergency.
Proper emergency.
I can agree. And in fact, I remember one, I don't remember the exact woman, but I remember the event where I had a woman and I explained to, she was so well informed and knew that, if we needed to go to a C-section, that, we've done everything that we've needed. We've lined it all up before the end. Now, as it turned out, she did need that. And as it turned out, it was a genuine emergency, which was so rare, where there was and so when we pushed the to emergency bell on this one, this was like a bigger emergency bell, not a regular emergency help bell, and the lift comes to the floor and holds there for the woman. We dash through pre-op, everybody's standing back and the doors are open. And I mean, it's an incredibly rare situation that occurs, and there's always a lead up to it. There's like stuff that sort of led up to that situation. And but afterwards, the woman was not traumatized at all, because we'd so briefed on everything beforehand. And she just assumed that anybody having a C-section was how it occurred.
Right.
And that was actually, honey, yours was at a different level.
Yeah.
But
I think that's a whole discussion on itself. Like, I feel like the word emergency needs to be taken out, and it should be planned and unplanned cesareans, because I think that adds.
Yes, I agree.
That adds to the fear. And I've sat around for 3.5 hours waiting for an emergency cesarean. So I can promise you there was no emergency there.
Exactly. Oh yes, yeah.
So I think that plays a big part. When women say, I had an emergency cesarean. So that really, as a human, you go, oh wow, that must have been very serious. It must have been something terribly wrong. But honestly, sometimes it's hospital policy and procedure that has women in theatres.
That's right. You're absolutely right. We really should be renaming it planned and unplanned.
Correct.
But the words elective and emergency are medical words to determine a surgery, whether it was planned or unplanned. And it's not, and it doesn't reflect actual level of the emergency at the time. I 1,000% agree with you.
And that's another
we have to work
story
on it.
for another day. We have to do another webinar.
Well, look, I just want to thank you so much for being here today, and and going over this information. We do. And by the way, I love the small world that we're often because you are in Australia, I happen to be in New Zealand world, where everybody knows everybody type of thing, but I did have a giggle when I saw Dale and Catherine as one of your pictures up there, because I do even across the ditch I recognize some of your clients there.
Amazing. It is a small world, and
aren't they people? But look, thank you, and thank you for those who are doing a wonderful rest of the week, and so thank you so much. Bye, everybody.
Bye, everyone. Have a wonderful day.
Thank you, Renee.
Thank Kathy so much.
Thank you.